Okay, we're here today with Jean, and Jean is about to start her treatment with Dr. Davis. Tell me, what brought you into the office?
Right shoulder pain and right knee pain.
Okay. And how long have you been dealing with both of those pains?
Probably since about the end of March.
Okay. Was it due to a slip and fall or an injury? It was. What happened?
I fell. Just lost my balance.
Just slipped and fell and landed on that knee?
Yeah, the shoulder.
And the shoulder. Okay.
Right side.
The whole right side is all messed up. Have you seen any other doctors for this?
No.
So this is your first attempt to get it corrected. So what would you say your discomfort level is in that knee? 0 being no discomfort and 10 being unbearable.
Today it's about a 3 or a 4. On any given work day, by the end of the day, it's a 7 on me.
Okay, because you didn't work today. You had today off. Okay, good. So you can come in here. I'm going to have you do a couple different exercises for me. And the first one that I'm going to have you do is I would just like you just to stand up for me, just to go from a seating position to a standing position. Okay. Did you have any discomfort when you did that? No? Okay. So I'm going to have you take one step forward. All right. I want you to put your feet shoulder length apart. Put your arms out in front of you. And I'm going to have you squat down, keeping your heels on the ground. I'm going to have you squat down for me. And then slowly come back up. Where did you feel that? I saw it in your face.
Right here in the front of me.
In the front?
Both knees.
On both knees?
Yes.
Was it above or below the kneecap?
It's like right on top.
Right on top there? Okay,
My
perfect.
shoulders.
Okay, for putting your arms straight out like that. Okay, I'm going to have you go up and down the stairs. And I just want to see how you maneuver the stairs.
Stairs are not my friend.
And then we're going to go back up the stairs. All right, Jean. So which was worse, going up the stairs or coming down?
Going down.
Down the stairs. And where was it hurting on your knees when you were going down the stairs?
In the front.
In the front? Above or below the kneecap?
Both.
Both? You're feeling it above and below. All right. So we're going to get you in there. We're going to have the doc work on you, and then we're going to see what happens next. Are you ready?
Ready?
All right. Welcome aboard, Jean.
1, 2, 3, 4, 5, 6. Keep going all the way. And 7. Good. Okay. Okay, so foot out, out, and down. Out and down. Keep going, keep going, keep going. There you go.
So I'm just going to have you walk down the end of the hallway. I just want you to see how it feels different walking. And the more movement you get in those knees, the more fluid that's going to get in there.
I feel stiff, like everywhere.
You feel stiff. You should feel loose. You're walking nice and smooth. What did you say?
Maybe I just need to walk a little bit.
Because you got to get the fluid in the knees. So any changes? Anything feel different?
I don't know. I don't feel like pain